Hey, all you respiratory instructors out there, Dennis Stanley here with LindseyJones University. It's time for another update to the 2027 NBRC exam preparation. What we're doing, what we're learning, we'd like to share that with you. You know, it'd be easiest for us to think, this is just our little secret, because we do help people prepare for the examination, but we don't consider it a secret. We want to be able to share everything that we're discovering about the NBRC exam for 2027 with you. We do realize that there is some anxiety. I say anxiety, you're probably just worried about that moment when you're going to have a cohort that it may be 2025 or 2026, but you know that even while you're teaching them that they're going to take the 2027 exam. So just to remind you, we've said in some other videos that in 2026, about mid-year, you're going to be able to choose, if you're using LindseyJones University, whether you are ready to switch that cohort over to the new exam material. The coolest part is that we're really trying to plan on not just switching your account over, but you can have two cohorts. You get to decide who's in your cohort on LindseyJones University. You can just kind of drag and drop the students in the right cohort. And then you can say, for this cohort, we want them to be on the 2027 information, but for the cohort that I'm working with now that's about to graduate, they can still be on the 2026 information for the NBRC exam. And so we'll continue to do that. If you have any questions, give us a call. If you're not using LindseyJones University and you want to know more, Laura at the office is the kindest person in the world. She'll be happy to give you a tour. As I said earlier, she'll even turn on LindseyJones University for a week or two or whatever, so that your students can actually use it and give you feedback on how they think it is helping them. And you can look at it yourself from an instructor's point of view. All right, so what do I have in my hot little hand? Well, I have the NBRC matrix. And just to show you, we've already kind of evaluated the matrix. And get close here, and you can see that we've already highlighted what is on the matrix that is new for the examination, or let's just say that wasn't on the previous NBRC matrix, also called the detailed content outline. And just so you know, we've highlighted about 100 different things that are going to be new to the exam. Now don't freak out. It doesn't mean that there's tons and tons of stuff that you're going to be missing. We think that there's a lot of things on this matrix that is on the exam that you probably are also already teaching. And I'll give you a few examples of those. So there's a lot of little changes, but there are some big changes and some patterns that we're seeing. And we'll be sure to inform you of those. Now, I won't try in this video to go through all 100 of those things. We'll kind of piece that out and talk about them in different videos along the way. But rest assured that in LindseyJones University, we're definitely peppering all those things in there, adding that information. But just to give you an idea, for instance, this is a small thing. They had that in evaluating a patient data and evaluating the record of the history, that we should examine the physician orders, but now they've added the word consultation. So not only the physician orders, but what other consultations might have made it to the chart. So professional consultations. We think that's a small thing, but it's just a terminology and a concept that we'll make sure we include in LindseyJones University in the book so that students are aware of that. And of course, you'll want to talk about that as well. The other thing here that's kind of new is vaccination status. Well, now that we're post-COVID, we understand that we can look at all kinds of things and think, what have they been vaccinated for? In the past, respiratory therapists as a concept or on the exam hasn't really shown up to care about stuff like that. Other things are like a little more information on IgE. There's another really common pattern that seems to be throughout the matrix, is they're using the words respiratory pathogen studies. Now that can be inclusive of all kinds of studies. So for instance, when we look at a CBC, in the past, we've talked about a CBC, the NBRC has, but now they're actually including the concept of getting a CBC and a differential. Differential is going to help us understand some pathogenic organisms that'll be there to a degree, but more respiratory pathogens. So we'll talk about it in those terms quite a lot as well. Again, I won't go over all of these, but just kind of looking over these things. Certainly we have general appearance, mental status, agitation, ability to cooperate. That's kind of somewhat of a new assessment. Again, that doesn't mean you're not already teaching it to your class. You probably are teaching these things. So I think when you look at these matrices, you might think, yeah, that wasn't on the old matrix, the old detailed content outline, but I've already talking about it in my class. But we will, more and more on a different video, we'll talk about some of the things that we think are commonly not talked about in class, so you can change that syllabus meet as instructors and decide what you're going to add. And then, of course, we'll be producing some information on that. So I wouldn't freak out about all of the new 100 things that are on this matrices, but on the matrix, but you do need to probably be aware of some of those. Probably is going to be some change on your syllabi. Now, I teach at a university and have been for 13 years, and so I don't only sit in my office and dream about what's on the NBRC exam. I actually am teaching, and so in a university, I teach a capstone 2-credit-hour capstone course for graduates of bachelor's programs, and so I know where you are and what you feel about that. I do also just want to take a minute and talk about patient data and our thoughts on patient data. Historically, we even talk about this right now in some of our seminars when we travel around, or in the online LindseyJones University seminars, is that we used to say that patient data is the most important thing you could know for the purpose of the exam. If you don't understand patient data, doesn't matter how good you are at interventions, which is another area of the exam, you won't even know that there's a problem if you don't know how to interpret patient data. But I want to just kind of talk about what we're really thinking and teaching about patient data now, and this is going to be heavily emphasized as we approach 2027. Is that we're looking at patient data not only from the point of view of being able to see data and understand what's wrong with the patient or what's considered normal, but also what do you do to treat the patient. Now, interestingly, when we get into treating the patient, we're really talking about interventions. So what we have figured out is that on the NBRC exam, they kind of separate those two concepts in some ways on their detailed content outline. So they'll talk about patient data over here, some laboratory value, but then way over in interventions, they'll talk about the treatment of that problem if you were to find. So what we're going to do is we're going to kind of tie those together a little bit more so that when a respiratory therapy student is studying patient data, they're looking at, say, electrolytes or whatever, they're looking at some kind of a data set, that even right there as they're learning what's normal, what does it mean when it's low, what does it mean when it's high, what do you do about it? So this is the weakness that we found, and you can ask your students about this as well. You can ask your students about a piece of patient data, an ABG, a CBC, whatever, and say, what does it mean? They can often tell you what it is and what it means, but if you'll start asking your students, and now what would you do about it? That's when you'll sometimes get deer in the headlights looks at you and say, well, I don't totally know. And so this is a new exciting area of focus, a way that we can integrate that into what we're thinking, and then help the student identify their weak spots. All over the country, we've been helping students do this. We'll say, yeah, we know you know what that patient data is, what it means, but what do you do to treat it if that happens? And very often they don't know. And that's an area that on the exam that they could get that wrong. So just to give you a little bit of hint, so keep track of us. Make sure you come here and watch these videos. We are also going to talk about our new insights into use of AI on the examination. So LindseyJones is using AI. I won't talk a lot about it now, but we recognize, let me just put your fears at rest just a little bit. Even though we can use AI to generate an NBRC type questions, and we probably generated about 100 of them so far. We've also noticed that on every single one of those questions, we have to have human eyes on it. And so while we are looking for ways to incorporate AI to teach students so we can round out their knowledge, we have come to the conclusion that we can't do it without human intervention. And you probably already know that. So every AI-generated question or concept that I've seen in respiratory therapy so far that we've played with and that's been out there, we've been able to find several points where like, that's not exactly right. Or from our frame of reference, that's not exactly on the NBRC exam, or we don't feel or sense that they word things like that. So we do think it has to be a melding of the human intervention and what we're seeing and experiencing, but also using AI to keep our mind fresh and well-rounded. So we'll talk about that more in a future video. That'll be coming up. Just want to give you a little bit of sneak peek. I'm Dennis with LindseyJones University. We look forward to preparing you and us and your students for the NBRC 2027 exam.